When an infant is born before 37 weeks of gestation, they will require special medical attention from an interdisciplinary team of healthcare professionals. Due to interruption in their development, premature infants typically lack the oral motor skills necessary for their survival. To establish these oral motor skills, nurses, doctors, speech-language pathologists, dietitians, psychologists, and occupational therapists all collaborate with one another to help these infants develop and grow. Unfortunately, there are circumstances in which the disciplines overlap and professionals will need to work as a team. One of the largest differences between the healthcare professionals caring for premature infants is the ongoing debate of whether to practice the methods of volume-driven or cue-based feeding in the NICU. Supported primarily by speech-language pathologists and psychologists, cue-based feeding argues that a pleasurable feeding experience is more significant to the infant's development than the intake of nutrients. On the contrary, volume-driven feeding is based on following the schedule and prescribed intake amount ordered by the doctors and dietitians. Once the doctor and the dietitian determine the feeding schedule and adequate nutrients that the premature infant needs, the nurses are expected to oblige by the doctor's orders and follow the specific details of the patient's care plan. This overlap of disciplines typically requires nurses to make decisions based upon their own judgments when they encounter obstacles while feeding premature infants. Although nurses are educated in their scope of practice, they typically do not possess the skills and knowledge of the professionals in other disciplines involved in neonatal therapy. A common obstacle that nurses face in the NICU is when an infant disengages from the feed before intaking the adequate amount. In this particular situation, the nurse may believe that the infant may be exhausted because they've exerted all of their energy using the slow-flow nipple. However, the speech and language pathologist may have designated that she wanted the infant fed with the slow-paced nipple because she's trying to instill positive feeding behaviors in the infant. It's important that the nurse take this into consideration because any signs of stress could alter the sensor-motor pathways, which can decrease the infant from wanting to feed and cause serious consequences of instability. To resolve these discrepancies in feeding methods used by caregivers in the NICU, neonatal nurses should be paid to shadow speech-language pathologists, occupational therapists, psychologists, and dietitians at least once a month for the first 2 years of their nursing career. Educating neonatal nurses on other scopes of practice may seem extensive, however, they are the primary advocates for these preterm infants. This new process will not only increase their comprehension of healthcare, but also improve their overall holistic patient care.